First, put your plasters. So we have 6 narrow plasters.
6 narrow.
1, 2, 3, 4, 6.
6.
Then dalawa for the OS. And then 5 for your other securing of bloodline. Pre-cut plasters. And then you open everything. Example, we're using gauge
17. Gauge 17 na red.
Needed. Eh? Sorry. Sterile na. Off kit, set aside. On kit.
Giset aside ang off kit, giset aside.
Open your 10cc syringe. And everything else inside your so you have your OS, you cut into 2. Aspirate saline hanggang 3. Only 3. Arrange. Put drape, shiny side, down. Sir, excuse me. You will put there.
Rough ang
Please,
nasa ubos.
tourniquet. Excuse me again.
Excuse me, sir.
Do not tighten, just leave it like that. Don gloves. Check for thrill. Palpate both sides. There's thrill. Check for brewy, step, auscultate. Brewy, whooshing sounds. There is brewy. Then disinfect. You ask the patient, sir, are you allergic to alcohol or betadine swabs? No. The patient said no. Okay.
No.
So start. So you can open all. Example, we open everything. Open everything. Yeah, set aside. Open. So first, one by one, arterial, inner to outer, start. Second, alcohol, inner to outer for the venous side, start. Betadine, arterial, inner to outer, discard. Second, betadine. This is it will make use of the betadine as our last antiseptic. So for the venous, inner to outer, and then discard. So if we have another alcohol swab, we can use it also. So we can use it like that, inner to outer, then discard. So So tighten the tourniquet. Get your arterial. Tighten the hub. Hold the wings like this. Twist and pull. Yan. Sir, I'll start to insert your arterial cannula. So let's start.
Okay.
Out the skin. Sir, 1, 2, and 3. Push the needle inside. Bevel up. Check for backflow. When there's backflow, flatten the angle and insert the needle. It's hard. Flatten the wings. Remove the tourniquet. And then place your plasters. 1 plasters per wing. Make sure your long plaster for anchoring the H. The fold is on the inside part of the patient's arm. Put OS and your plaster. Fold of the plaster inside the patient's arm. Make sure it's curved. Loosen the cap or the hub to for the blood to flow until the end, and then tighten, clamp, remove, put. Get your 10 cc syringe with saline. Position first, like this. Tilt your syringe and clamp, push, clamp, remove, put back your hub. That. Okay, set aside. Next, your venous. Tighten the tourniquet. Get your venous cannula, the one with the blue clamp. Tighten the hub. Hold the needle wings, the wings of the needle, and then remove. Twist and pull. Sir, I'll insert. So towel, using your non-dominant hand, and insert. 1, 2, and 3. Bevel up. Once it's inserted, check for backflow. When there's backflow, flatten the angle. Insert. Flatten the wings. Remove the tourniquet and place your plasters. Fold of the plaster should be inside. Place your second OS. Plaster. Using your 3. Plaster. One, make sure it's curved, do not extend. Get your loading dose, heparin. Run, loosen the hub for the blood to flow until the end, and then tighten. Clamp, remove the hub, take it there, put your heparin, loading dose. Position first, tilt your syringe, unclamp, then push and pull slowly. Push and pull 5 times. Slowly. Second. Third. Make sure your non-dominant hand is holding the end of your patient's end, the cannula, and your syringe. Fifth. And clamp. Remove. Put back your hub. There. Then, remove everything. Put this on your receptacle. And then this one you throw. example, so this one you put it in your receptacle. For example, we have our receptacle here. We place everything here. Sample.
Sample receptacle daw to.
We check for residual. Diba? When you heparinize it for 5 minutes, and then you check for residual. So for your blood lines, when it's connected like this, before you disconnect, clamp, remove, retain the lure lock on the venous. And check for residual. So remove the lure lock, check for residual. On the second drop. First drop, second drop, check. It's clear. So, turn the lure lock and then you drain. 20 seconds for the arterial, 19, 20. Clamp. For the venous, 1 minute. Unclamp and start blood pump. Blood pump is 200. So, for a minute, 58, 59, 60 seconds, clamp and stop. There. Then we start to hook. Before hooking, check for dialyzer. Sir, dialyzer name, reuse number, LOPS 18. And then check for the airlock. There. Remove the lure lock and you start to hook. The lure lock goes to your waist, your receptacle. Yeah, your receptacle. So when we connect, loop, like this, loop, so that it won't dangle plaster. And then connect. Blue, red. Okay? So make sure it's clamped. Remove. Like that. Connect and secure it with this one, rotation. And then the other one, make sure it's clamped. Remove. Connect and then secure. There. And then your 2 hubs, put it on your receptacle. There. And then we start to unclamp. So unclamp first those clamps on the patient's end, on the cannula first. And then those on the blood lines on the patient's end, the big clamp. 1 and 2. And then, on the new machine monitor, we press the green person. So, green person, press. Beep. Dialog box appear, and then press the confirm. Before pressing, you check if it's lighted. If it's lighted, then you press confirm, and then start. Default is 100. You increase it to 150. So, plus 150. Okay. And then you secure your blood line. Make sure it has allowance. So it's curved like that. Then make use of your last plaster. There. And then remove your tourniquet and your tape. Sir, excuse me. I will remove your tape. And then fold. Put everything there. Set aside with your off kit. Keep your tourniquet. And then BP. BP on the other arm. The arm without the fistula. So after doing your VS, you prepare your off kit. So what we need, your off kit, the drape. Drape your off kit fistula. So for your OS, and fold into half, 1/4, and then 1/4 also. Make a flower. Also the other one, fold into half, 1/4, 1/4, 1/4, and 2 flowers. Put everything inside with your 2/4 alcohol swabs, your drapes, and your band-aid. So remove everything. Remove. Inside. So with your receptacle, you need only this one, the 10 cc. Discard this one, the needle cover, and 3 halves. No, wait. So you fill this one with 3 cc saline. 2 lower locks. So you place everything here. The 3. And this one, you connect na lang. And then you plaster it. You plaster this one on your armchair. Plaster. Then your receptacle, you wash it on the sink in your station. So for termination, use your off kit.
Termination na na.
Remove everything. Remove. So arrange. So 15 minutes before termination, prepare your saline.
Saline.
So this is your saline. Example, this is the saline
Red.
part of your blood lines. Then this is the saline. Make sure it's clamped. All clamped down. Remove. Remove. Attach your lower lock on this side. And then just hang it like that.
Red may
This
sa ma'am.
one, cover with your hub.
Huh?
You can also prepare your injections prior to termination. So same, with the same drape on your pre-EVF, use that. Also, tiny side down. Excuse me, sir. So place it there under.
Rough ang sa ubos, rough.
Don your gloves.
Rough.
So remove your plaster, the one you secured on the patient's wrist. Plaster and then place it on your drape. For termination, let's say this is 1 minute. So the alarm goes, the alarm sound. So from green, the lights on the side will turn to yellow. So when it alarms, press the red cursor. So press the red, and then wait for this arrow to light, and then press confirm. wait for the blood pump to stop. When it stops, then you proceed here. You clamp first your arterial. Clamp, then remove. Place it on your other finger. Put your syringe with the 3cc saline set aside, and then connect this one to your saline line. Your saline line will move closer to your blood line. Remove, connect, then open and clamp, roll clamp up like that. Set aside, and then press the confirm. When you press the confirm, the blood pump will start. So the default blood flow is 100. You increase it to 150. So plus 150. And then you proceed to your patient cannula. So position first, unclamp, push, and clamp. Remove, put back your second half. While waiting for the blood to be returned to the patient, so make sure it's pinch. So for the new machine, it will detect more saline in the blood. So when the blood stops, the blood will stop. So you can see there our infusion volume. Next, when the blood pump stops, you clamp the remaining clamps. So clamp the one on the patient's end first, and then the big clamp. Remove like that, and then secure it with your last half there. So this one, connect it with your other patient's end. So before at the attaching clamp, roll clamp down, remove the saline, and then kiss together. Then unclamp. You hang it on the machine, and then press start. So it's recirculating. So after that, you go to your patient and do your blood pressure taking on the other arm. So when it's normal, so BP is 130/80 normal. So let's proceed to removal of the cannula.
Termination.
Remove your plaster.
Termination.
Hold your cannulas through. Hold the cannula so that it won't dislodge. Remove the tapes. For the wing. So we draw halfway back. Put your OS, but no pressure yet. So you count. Sir, I'll remove 1, 2, and 3. Remove and press. Fish hook. Somebody will hold this one. Somebody will hold your other OS.
Somebody will hold the
Material. Get your other OS. So we draw halfway, 3/4 length of the needle. Place your second OS on top. Sir, I'll remove your needle. 1, 2, and 3. Press. Then pressure time
10 to 15.
10 to 15 minutes. So put pressure. When you check after 15 minutes, checking for blood flow, for bleeding, if still with bleeding, for the venous part, check it like this. When there's no more bleeding, you put bandage. Then other bandage. But somebody will help you to put bandage. So for the arterial part, for checking the arterial, check it like this. Okay. No more. Put bandage. Put bandage. There. Then use your alcohol prep pads to clean the other patient's arm, other part of the patient's arm. Clean. After cleaning, you remove the rib. So place everything here on your ribs. Biodegradable. This one for the shark. After that, after you clean your armchair, go back to the patient and take your blood pressure. The end.
Yes, mas shorter ni.